Hi there, I'm Dr. Susan Hartley, and I'm so glad you've joined me today. We're going to talk about something critical, but also empowering. Did you know that women's heart attack symptoms are often very different from men's? And because of that difference, thousands of women every year miss the warning signs and don't get help in time. So today, I want to show you exactly what to watch for, why your body may send silent signals, and what you can do starting today to protect your heart. But first, if you haven't already, please hit that subscribe button and give this video a thumbs up. It helps us reach more women just like you who deserve to know the truth about their health. And don't forget to comment below and let me know where you're watching from. I love hearing your stories. Let's get started. Part 1: Why women's symptoms are different. We've all seen the Hollywood heart attack scene. A man clutches his chest, collapses, and calls 911. But in real life, especially for women, that's not always how it happens. In fact, up to 50% of women don't experience the classic crushing chest pain at all. Instead, women's heart attack symptoms tend to be more subtle and more likely to be ignored. Why? Because women's smaller arteries can block in a different way, and our hormones affect the way blood flows. That means your heart may send out different signals, ones you might not recognize right away. Let me tell you about Carol, a 62-year-old woman from Florida. One evening, she felt a little nauseous, dizzy, and unusually tired. She thought she just needed to rest. But hours later, she was in the ER having a heart attack. She told me later, "I never felt that elephant on my chest they talk about. If I'd known what to look for, I would have called sooner." Her story is all too common and preventable. Part 2: The top symptoms women should watch for. Here's what women often feel during a heart attack: unusual fatigue, suddenly feeling exhausted even at rest; shortness of breath, struggling to catch your breath; lightheadedness or dizziness, feeling faint or unsteady; pain in unusual places like your back, jaw, neck, shoulders, or even your stomach; nausea or cold sweats, feeling sick without explanation. These symptoms may come on slowly and may not feel severe. That's why so many women chalk them up to stress, menopause, or just being out of shape. But here's the truth. If you feel these symptoms, especially more than one at a time, don't wait. Call 911 right away. Part 3: Why early action saves lives. Minutes matter. The earlier you get treatment, the less damage to your heart muscle, and the better your chances of full recovery. So if you're in doubt, always err on the side of caution. As I tell my patients, it's better to have a false alarm than to wait too long. And even better, start protecting your heart before you ever have symptoms. Here are 3 steps you can take starting today. Eat a heart-healthy diet rich in fruits, vegetables, whole grains, and healthy fats. Move your body every day, even just a 20-minute walk. Manage your blood pressure, blood sugar, and cholesterol with regular checkups. Part 4: Carol's comeback. Remember Carol? Today she's thriving. Carol thriving. She made small, powerful changes to her diet, started walking with a neighbor every morning, and takes her heart medications regularly. She told me, "That night changed my life, but now I feel stronger than ever." And that's what I want for you, to feel empowered, not afraid. Because knowledge is power and your heart is worth protecting. Final thoughts. Ladies, listen to your heart. If it whispers that something is wrong, don't ignore it. Your life, your strength, your story deserve to continue for years to come. And if you'd like my free guide, the Women's Heart Health Checklist, you can find the link in the description below. Until next time, I'm Dr. Susan Hartley. Your health is your power. Start protecting it today. Here's the truth. When a woman has a heart attack, it doesn't always look like the dramatic scenes we've all seen on TV. In those scenes, a man clutches his chest, gasps for air, and collapses. But in real life, especially for women, the signs are often much more subtle and much easier to miss. That's why thousands of women every year don't recognize what's happening to them and don't get help in time. You see, women's bodies are different. The arteries are smaller, the blood vessels react differently to stress, and the way plaque builds up can be more diffuse. That means the warning signals your heart sends might not feel obvious, but they're still critical. I can't tell you how many women have come into my office saying, "I didn't feel any crushing pain in my chest, so I thought it couldn't be a heart attack. I just felt off." And that's exactly the problem. So let's talk about the top symptoms women need to watch for and what they really feel like. Unusual fatigue. This is the single most common symptom women report: sudden, overwhelming exhaustion, even when resting. One of my patients told me, I was just sitting at my kitchen table, and it felt like someone had pulled the plug on my energy. I couldn't even stand up to walk to the couch. If you feel exhausted in a way that's new, intense, and unexplained, pay attention. Shortness of breath. Another common warning sign is struggling to catch your breath, even while doing light activities or just sitting. One woman described it to me like this: it was as if someone was sitting on my chest. I couldn't take a deep breath no matter how hard I tried. Lightheadedness or dizziness. Feeling faint, weak, or like you might pass out is a sign that your heart isn't pumping blood properly. Pain in unusual places. This is where women often get confused. We're taught to expect chest pain, but for women, discomfort can show up in other areas: your neck, your jaw, your upper back, your shoulders, or even your stomach. It may feel like pressure, tightness, burning, or even mild discomfort that comes and goes. One patient said, I thought I had pulled a muscle in my shoulder, but it was actually my heart trying to warn me. Nausea and cold sweats. Some women feel queasy, vomit, or break out in a clammy, cold sweat without any clear reason. The problem with all of these symptoms is that they're easy to dismiss. We tell ourselves, I'm just tired. It must be stress. Maybe it's indigestion or the flu. But here's what I tell every woman who sits in my office. If you notice one or more of these symptoms and they feel unusual for you or they don't go away, call 911 immediately. Do not wait to see if it passes, because every minute you wait, your heart muscle is being damaged. And the sooner you get treatment, the better your chances of full recovery. So take a moment right now to commit these symptoms to memory. Better yet, share them with your sisters, your daughters, your friends, because every woman deserves to know what her body is trying to say. In the next section, we'll talk about why early action is so powerful, and what simple steps you can take right now to protect your heart every single day. Like, subscribe, and share this video,